I think that is a two-part answer. On the one hand, this science, to me, is the most profound, most complex, admittedly, but most profoundly hopeful science I've ever reported on. I've written quite a few books, because as we have this new understanding of the brain, we also have this race to understand and see signals for when microglia begin to shift from, remember we talked about how they're catering to neurons like movie stars, they're bathing neurons in synapses and protective factors. Well, this work at Broad Institute in Boston and many other places is starting to assign what we could think of loosely as barcodes to every state that microglia can be in. So your happy microglia are running around and they're taking care of your synapses, and you're thinking pretty well and you're feeling pretty great. As they begin to shift and become assassins, and they start to spit out these inflammatory factors, or they start to morph into these big bushy Pac-Men, they literally change their shape and size. If we can assign different kind of like supermarket barcodes to them as they begin to change their activity and test for that, we can begin to know when they're starting to change their actions. That sounds like crazy far off science. It's not, it's happening. It's not here right now, but some aspects of it are here right now. At Shock Trauma, at STAR Research over at Shock Trauma, the research arm of Shock Trauma, they've been able to, Alan Faden has been able to look at factors that are released by microglia in the brain. These factors descend into the bloodstream and can be measured in blood tests. And this is being used now in concussion. So if somebody has a concussion, it may look like a mild concussion, right? Or it's hard to tell. Who is responsible in the brain? What's responsible for the severity of concussion? Big surprise, microglia, right? And so as microglia get active after a concussion, how active they become determines whether that concussion is mild or severe or anything in between. So if we can look at these descendants of microglial activities, these factors that they express, and go, just like you might take a white blood cell count, right? Everybody knows you think you're sick, you go to the doctor takes a white blood cell count. If we can begin to look at their activity and know that somebody's concussion is really severe, then we can treat it differently. A doctor can ask that patient to do things very differently than they might for a mild concussion. And guess what else we can do as the science comes closer to reality? We can determine which treatments are working for people, right? So right now, if you have a patient with a concussion, early Alzheimer's, because that's it, the longer something's in motion, the harder it is to intervene. Depression, or let's say you have a 12-year-old girl in a family with a lot of depression, and maybe there's a lot of Alzheimer's in that family, and maybe that child also had a concussion at 10. We may have a time, and I don't think it's that far off, where a pediatrician might be able to suggest a blood test, kind of like we test for cholesterol, and say, there is a lot of microglial activity here. Why don't we think about ways, and this gets to the second part of the hope, that we can address the brain the same way that we're keeping your child's immune system healthy. So the second most hopeful thing to me is that we don't tend to think of the brain the way we think of our body. We don't think to protect our brain's health the way we think of our physical health, and they are one and the same. So that to me is profoundly hopeful, that you can help people to understand protecting the health of your brain's immune system is something we need to be thinking about every day and from a very early age.